Hello and welcome to Talking Live. I'm Dr. Robi Ludwig here in Starshop Studio right in the middle of Times Square, and we are certainly feeling spring in the air. Today we have one of my dear friends, Dr. Tabasum Mir. She is a celebrity physician and skincare expert, and she's also the CBS podcast host of Glamour, which I was also lucky enough to be on your show, and one of my favorite interviews, by the way. We're going to talk about just what's out there in the consciousness in terms of plastic surgery myths, what patients are asking for, and cultural ideas about aging and how American ideas are different about French ideas. And so we're just going to get into it also. If you have any questions, reach out to us. But without further ado, Tabasum, thank you so much for coming.
I love your studio.
Oh,
this
thank
is amazing.
you.
I'm so happy you're doing this.
Well, really, you interviewed me, gosh, I don't know how long ago it was.
Maybe a year and a half or 2 years ago.
And it was one of my favorite interviews because you're like me. You do all the research. And so your questions were so smart. And it was just a real pleasure. And you have so many celebrities on your show.
Yeah. I just, having been on the other side, having been in front of the camera, having been interviewed by people, one of the things I didn't like when people weren't prepared.
Right.
They didn't know anything and they were asking questions that showed that they didn't really pay attention to who was coming on.
Mm-hmm.
And I didn't want to make my guests feel that way.
And you totally did not.
Yeah.
So, and it was a real pleasure and it went by so quickly. And I know exactly how you feel. It's like when you have somebody on your show, you want to honor them by recognizing the full range of what they do. First of all, you have a practice right here in Soho.
Yeah.
But you also were on Bravo TV
for
the Singles Project.
Absolutely. It won an Emmy.
Yeah. I think we have a picture of you and the staff, or not the staff, your other castmates. We have it coming up.
Stephanie is not a castmate.
That's not a castmate. No, wait.
Those are not castmates either.
Right there, there. We have the castmates. Do you still keep in contact with them?
I keep in contact with everybody but Brian. I don't know where he is.
Okay.
But the others, In fact, I saw Carrie just the other week. Joey, all of them. Yeah, all of them except Brian.
Oh, that's kind of nice.
Yeah.
That's nice.
We were all just regular people that didn't know what we were getting into, and all of a sudden we're in front of cameras. Mm-hmm. People thought that we were actors, and we really weren't. And one of the things I loved about it is I love the whole camera experience. I love doing the positive stuff, but I don't think that they showed enough of me at work, which I would have liked more of, but what are you going to do?
Yeah, well, you don't get to, I guess, produce how it's done, but in your own show, you can change that.
Yeah.
One of the things that we were talking about was just a lot of the plastic surgery myths that are out there.
Yeah.
So I wrote down a few to see if we could address them and see if we can correct some of the misunderstanding that's out there. Okay. I love this myth. Plastic surgery is only for vain people.
Okay, so when I decided to pursue this field, people said that's vanity. It's very vain. I look at it like this. If it's done healthy, if it's done with proper guidance, and it improves your mental health, makes you feel better about yourself, you're going to perform better. Yeah. So is that vain?
I don't think so. And also,
you're a mental health care professional. Is that vain? If you're doing it healthy, you're doing it to improve something, and it allows you to perform better at work, socially, that's not vanity for me.
No, I think as long as someone is working with a trained professional who knows what they're doing, they're doing it from a healthy space, they understand the limitations of what plastic surgery can actually do. But no, to see somebody feel better on the outside, and I always say this as a therapist, sometimes feeling good starts from the inside out, but also there's bidirectionality. So if we change our body on the outside, sometimes that impacts us on the inside. So I say, if there are people that are talented and able to tweak things that are bothersome, why not? You know, we want to feel as good as we can about ourselves, and we should have that as an option. Okay. Here's the second myth, which I think is a really good one to address because people have mixed feelings about this one. Only extremely rich people and celebrities can afford plastic surgery.
Only extremely rich people and celebrities can afford a lot of plastic surgery. I think that people can get it done if they are are looking at something that's a goal. Say that you're 18 and your nose has always bothered you, and you achieve and you spend the money towards that. You're investing in yourself. I think it's not that only rich people can afford it. I think people that have a lot of money can probably afford more.
Yeah, that's a good way of putting it.
Yeah, and but that does not mean I have police officers as patients. I have teachers as patients. I have students, and most of my patients are not, extremely rich. They're just normal.
And they save up for it.
And
it's not, I think what you said is exactly right, that not all procedures are really expensive. Like some of the Botox is not really expensive. People can afford it. And even if you do a little bit, it can go a long way.
Or save for it. You can budget for it, just like you're buying something else that's of value. And you'll value it more when you do that.
That's very true. Okay, Botox looks unnatural.
The majority of people that come in and out of my office that get Botox done, you would never know it.
Yeah.
It's the ones that you notice that cause you to think that it all looks unnatural.
Right.
And more men are getting it done too. A lot more
I believe
men.
that.
Yeah.
I believe that.
So that is a myth.
Because men are increasingly more sensitive about their looks now.
Yes.
As we become a more, I think, visual society, and also now that in terms of economics, it's more egalitarian in terms of couples, like both the men are bringing in money and women. So I think it impacts.
I've noticed throughout my career that the men that were like in their 20s or 30s or hitting 50s are now noticing that there's a younger group beneath them that are hustling and looking younger. So they're competing with that. Men are competing with younger men.
And that is an issue that I hear a lot in my practice. Once people hit a certain age, they're like, oh, I don't know if someone's going to want me.
Yeah.
And so people do try to look as young as possible. And what I find is it's sometimes really hard to tell what decade someone's in. I don't know always.
Yeah,
I could be off by a few decades.
Right.
Because people are there's kind of a generational blurring that's going on right now because people can maintain looking good so long.
Yeah. It no longer is waiting till you're 50 or 60 and then doing something.
Right.
People are doing something as young as, I've had people in their late teens coming in for tweets.
I don't know how I feel about that, but we can get into that later. No matter what procedure you get done, it will last forever.
See, that's another thing that people don't understand. I wish, right?
Yeah.
If I colored my hair once and it could stay that color forever and I never needed touch-ups, I tell people it's the same thing with skin. Your skin is constantly growing, and guess what else it's constantly doing? Aging.
Yeah.
So your skin is going to outage the procedure. So you have to keep it up. Another myth that people say is once you finish the procedure, it wears off, that you look 10 times older. That's not the case. You've actually prevented yourself from aging by doing these things along the way.
Right. And I think that's really important to know. And we spoke earlier today, and you mentioned to me, you sent me a link about page 6.
Yeah.
And
this is always
we have a link, just a copy of the page 6 that you sent me. And it's right with the black and white. We'll get there.
There.
Right there.
There it is.
And you mentioned how a lot of the stars are trying to get the same look. And I don't like when I see everybody trying to look the same. Sometimes I don't know, because I'm not part of that generation that necessarily knows who every single actor is.
Well, who are these guys?
Well, I know who they are because I watch reality
TV. That's the mom on the far right. And the daughter's 3 over. These are 4 different women, all different ages, different ethnicities.
Who's the one next to Kim?
That's Khloe. You're talking about here? That's Khloe Kardashian.
No, I know that's Khloe.
The one next to Khloe?
Brielle.
That's Brielle.
And who's the one other?
Larissa Pippen.
Who's that?
She's Scottie Pippen's wife. Ex-wife, I think.
Oh, okay.
Yeah.
See, that's what I'm talking about.
This is also a black and white photo, so that makes them look even more. But a lot of the social media influence is really making a lot of us look for patients that are asking for the same things. The lips, the buccal fat removal, where they remove the fat in their face to have that more gaunt look.
Oh, okay.
And it's starting to become a very homogeneous look amongst all of the
You know what
celebrities.
I really don't like? The cheek implants
or it's filler. Oh yeah, the implants.
And it looks bad.
Yeah, Madonna's a good example of that. I don't know that she's had cheek implants. I have no idea, but it's that kind of full cheek look.
Yeah, I don't like that.
A lot of plastic surgery doesn't make you look younger. It just makes you look like you've had a lot of plastic surgery. Yeah.
So what do you think the thought process is? Do you think people come in and say, I want bigger cheeks? Or does somebody say, you'll look younger if you have bigger cheeks? What is that about?
It's an influence by their surroundings, social media. You and I were talking about this the other day. When I was in high school, I had to worry about like comparing myself to the other girls in my school, maybe a girl from the school next door. I can't imagine what it's like now to have to compare yourself to women across the entire world.
Yeah.
You know, and then to be able to have the access to inexpensive procedures. A lot of these people aren't necessarily going to physicians. They're going to somebody who can buy it off the black market. And
that's
they're
scary.
all mimicking the standard of beauty right now. And the standard of beauty right now is the thin waist, the big backside, the large lips.
I like the big backside. I'm not going to lie. I like that. I think that's a good, let's keep that.
But you know what I'm talking about.
I know.
The ones that are injected. Yeah, no one's complaining about the big backside.
And I think we also have some pictures, and you mentioned too, like on Instagram, there's plastic surgery gone wrong.
Yeah, if you follow some of these hashtags. But people are proud of this, that stuff that they've done.
And it is disturbing to me to see people really just butcher themselves. And we have this example of really, I don't know who this person is. Is she Iranian? The one who wanted to look.
Yeah.
Not that it matters where she's from, but I don't think she's from this country. And she wanted to look like Angelina Jolie. And that is, in my estimation, what we call body dysmorphic disorder, which is when someone has an obsessive compulsion to fix something externally that's really an internal issue. So it never really gets done. And so the procedures happen in an obsessive way, and it starts to take on a bizarre alien look. And actually, the doctor who is ethical will say, I'm not taking you on. Now, there will always be another doctor who will do it. But what do you think when you see something like that? I mean,
I think that the doctor-patient,
freaky.
Yeah, the doctor-patient, and I always say doctor, but there's so many people doing this that aren't physicians. And they're not going to necessarily hold up the same standards as a physician is.
Right.
So nowadays, it used to be that if a doctor said, this is what you're getting done, and you want to listen to that physician and pay attention to the advice they're giving you. I feel like the relationship has changed where patients come in with an ideal of beauty that they want to achieve and will search until they find someone that will give it to them.
We actually discussed this, and I wrote an article about this, how social media was influencing beauty for Bella magazine. And that's going to come out, I believe, in the next magazine that comes out for Bella. So you can look for that. But I really talk about there's some positive aspects where the younger generation, like maybe even younger than millennials,
definitely younger,
are curating images of themselves, and they're finding their own beauty. But what they're doing, sometimes in a good way, is saying to their physician, this is how I feel beautiful and this is how I want to look. And it's no longer the physician saying, the plastic surgeon saying you need to get a chin done, you need to get your nose done, you need to get your breasts done.
No.
So it's more, the patient is feeling more empowered to direct.
Empowered and somewhat entitled.
Okay.
Because they know that someone is going to give this to them. I had a situation where people came to me for lip injections. They already had really large lips. Oh. And I said no.
That's another look I don't get.
Yeah, I said no. And they were in their early 20s. I said no. I said, come back to me in like 6 to 8 months and let's look at it again. And I saw their social media just a few weeks later, and they had gone to somebody did it for them.
Yeah.
So that's a challenge.
I mean, how big do your lips need to be? Now, where does that idea of beauty come from?
I think it's comparing yourself to other people on
maybe
social media.
Models. Maybe our role models.
Well, role models are sometimes other Insta celebrities.
Right.
Other people that have a large following that have the body shape that they have from procedures, or if they didn't have it from procedures, somebody can do what they have, what it takes to get that. It's all over with women getting the implants and the waist and the hips and the lips so that they can get that attention.
I remember talking to an older patient of mine many years ago, and this predated social media a bit. And she actually had a facelift done that you would never know. It was really beautiful and classy, and she was an artist, so it didn't surprise me that she would do something in a very tasteful and also very bright. But she would say that a lot of these women would have these procedures done and the men don't like it. So it wasn't like the men were attracted to it, but the women wanted to prove that they were of a certain social status to afford it. And the men weren't liking
Designer
it, but the women were making a point, like, I'm wealthy, or I can have this, that, or the other thing done. And that's the statement they wanted to make. It's kind of a comment that never left me because I thought it was so interesting.
Yeah. It is interesting. And funny thing, a lot of the patients that are female come in and they want to do things when their boyfriends or husbands are out of town because their husbands and boyfriends don't like it.
They don't like it.
Yeah.
The men don't really like, I mean, most of the men I talk to, they like someone to look glamorous, but they don't want that faux look.
There's this weird fear of aging in this country. Your women are judged by their age. They're meant to feel I mean, you wrote a book on this.
I did. And you spoke to, and let's get a picture because I have it.
All right.
Catherine.
I adore this
Malandrino,
woman.
right?
Catherine Malandrino.
She's a very successful
French designer.
We have her right there.
Very successful French designer between New York, lives between New York and Paris. And I interviewed her, and I just, the stuff that she was saying about women and what we need to do to change our perspective of beauty and aging blew my mind. I said to her, I'm like, she wrote a book about the differences between French women and American women. And she said both have really great qualities. But the one thing about the French women is their idea of age is very different than the American. When you're 18, I've seen it, girls as young as 23 feeling like they're getting old. And we all know somebody who knows somebody who's like, and she said in France, women don't even think about plastic surgery till they're close to 60s. And I'm paraphrasing a little bit, but I said, well, why? She's like, well, because we don't think we look bad.
Yeah.
Aging is beautiful. And women who are older are seen as beautiful.
See, they feel sexy at various ages. And in part, and I did a little research because it's really true. In our culture, we are youth obsessed, which is really unfortunate and has influenced our cultural ideas about beauty and what we want to achieve. Whereas French women, it's an older culture, and they see themselves as beautiful and seductive, and maybe needing a haircut, or keeping themselves in shape, but not really needing to achieve an age that they're not. That beauty exists in every decade, and they kind of laugh at our ideas about aging, and I'm glad that they do. And I'm glad that that's out there.
We have something to learn from that.
You know what's so interesting, though? In fact, Juliette Binoche, who is 44, and she wrote, that a lot of the procedures don't make women look younger. It just makes them look like they fear aging, which I thought is not something that you really want to do. You don't want to. You want to embrace your beauty at every age. And I don't know if you know this. I live for this woman in history, and I learned about her from a documentary called Take My Nose, Please. Have you heard about it?
No.
It's about a woman's journey, several women's journey about deciding whether they wanted plastic surgery to enhance their looks and their struggle. And in the documentary, they talk about one of the first female plastic surgeon. She was French, and she went to medical school because her husband, who was 9 years older, was a doctor, and she wanted to work with him. And after seeing Sandra Bernhardt look refreshed, she pinched her face and eventually discovered this kind of mini facelift that she would give for free to women who were in the workplace and getting fired when they were in their late 30s.
Oh, wow.
And she wanted to help women keep their jobs by looking more youthful because she felt it was really important for women to earn their own salary. Her name was Dr. Noelle, and she was known as Madame Noelle, and she was known as one of the best plastic surgeons in France. Wow. So I just think it's really interesting that the French have this acceptance of aging, but yet this woman who is a plastic surgeon helping women was French.
Yeah.
So I just think that's kind of interesting.
Yeah, that is interesting.
Yeah.
It sounds like she's doing it for altruistic reasons. She's doing it for free. So,
and she was a feminist. She
Yeah.
wanted women. This was in World War II. I think it was World War II. She wanted women to keep their jobs. And if they looked too old, they would lose their jobs. So she would donate her services for free so that they can continue working. And she said, don't tell anyone. And that's where the secrecy of facelifts came in. She said, don't let anyone know because I want you to keep your jobs and kind of like fool people so that women could work. And she believed in women voting and working and just what a fascinating woman.
Yeah.
Well, times have certainly changed because there are people certainly bragging about their procedures today.
Yeah, definitely. There's procedures that people are getting and people are putting on social media and they're tagging it and they're basically very, very excited. It's like MTV Cribs, but for the face.
So what do you think as a physician we can do to embrace beauty at any age?
I think relax a little bit. Everybody needs to just relax. You know, I have friends. We all have friends. If you take a photo, they Photoshop it till they're unrecognizable, and they won't post it.
Stop sharing my secrets.
Or I've had people that experience where they won't let you take a picture with your camera.
Yeah.
And I think that's kind of where it starts. Let's just put photos out there. Like it doesn't have to be a bad photo.
I admire people that put photos out there that are imperfect. I'm like, good for them. They're bold.
I'm just, I think the first thing is to relax a little bit. Like we all have the filters and all of that.
Yeah.
But just there's at a point at which if you find yourself overly criticizing yourself or obsessing, it's time to take a step back.
And also develop your inner self.
Yeah.
Develop your interest level.
Find
develop your intellect.
Yeah,
develop your inner and outer.
Yeah. And figure out what's really wrong. Is it that you're really feeling like you have a deformity that you really want to fix? Is it that you want to attract a certain impression of yourself? Figure out what's really wrong with you, if there's anything wrong.
Right.
And work on that. So,
let me get to the quick five because we do a quick five here.
I like this.
Okay, and I'm going to just take you through a series of questions which you'll answer so people can get to know the real you.
Okay.
Okay.
Oh, no.
If magic was real, what spell would you try to learn first?
How to control minds.
Ooh, I like that. What about the opposite sex confuses you the most?
Oh, how they can just get up in the morning and walk out the door and not have to put hair and makeup on.
God bless them. Men have it so much easier, don't they?
Like they can get up.
You
and
have
like,
a very
hey.
good-looking. You have a very good-looking boyfriend,
He
so
wakes
he
up
probably
like that.
he wakes up like that. Andy, do you want to show how cute you are so people can see? Okay, we'll get a picture. He's playing shy. What habit do you have now that you wish you started much earlier?
Oh my goodness, which habit do I have now? I can tell you which habits I have now that I wish I don't have, that I didn't have when I was a kid. I think I procrastinate a lot more than I did when I was a kid.
Okay.
And what habit do I have? I think, I don't know, eating healthy, the gluten thing.
Yeah.
I didn't know that I was gluten intolerant for a very long time. So.
Well, yeah.
That's not really a habit, but.
Well, it is. Eating the way you need to eat is a habit, is a good habit. What's your secret talent?
Patience.
Patience.
Yeah.
That's good.
Yeah.
Yeah, you seem like a patient person.
I try.
Yeah. I'm probably not as patient, but
you're a very nice person.
But I'm a really nice person, so that's all that matters. All right. What always cheers you up when you think about it?
Oh, seeing him smile or seeing my niece
come on, Andy.
smile.
We don't want to tease the audience and not show your good-looking face. Come on. So Andy is Dr. Mir's very handsome boyfriend, and he's also in the TV business. And we're happy to have him here with us. Lend support, and he's been taking pictures behind the scenes. And we want to thank you for joining us on Talking Live. We love having you. We're going to have more information on Dr. Mir so you can find her, look her up, and figure out if you want to learn more about the products that she has or just see her in Soho in New York if you're ever in the area. Or, oh my God, or the podcast.
Yeah.
We'll have a link to your podcast. I'm sorry, you do so many interesting things.
I can't
That's
keep
why
track.
I need you here to keep me on track. Or the CBS podcast, which is great. She has amazing guests, very high profile. And thank you again. We'll see you soon.